Well, June is Stroke Month, an opportunity for us to really shine a light and raise some awareness about stroke. And today we are joined by Ruth Whalen, a stroke services clinical nurse specialist, and Heather Qualley, who had a hemorrhagic stroke. Now, Heather, let's start with you. Tell us your story.
Well, on the weekend before, I was in Houston, New York, getting a great dress, a fabulous dress for my brother, my husband, for my son's wedding. His wedding was the following Saturday. And on Tuesday, I was home tossing laundry in because we were coming up to Saskatoon to be here for the big event, and very excited about it. And suddenly, I screamed out to my husband, "I'm having a stroke." And I just started collapsing, and my husband luckily was home. I knew the signs of a stroke, and he came and got me. He knew the signs of a stroke and immediately called the hospital. And so I woke up a couple days later and couldn't move my right side of my body. So it was shocking. You go from being a person who's just doing normal stuff to suddenly, having a very different life.
Wow. Now, what a story, Ruth. We are seeing more stories like this. I mean, yes, stroke numbers are indeed on the rise, but we're also seeing more people surviving. Is that right?
Yeah, like in Canada, a stroke happens about every 5 minutes. And the risk factors related to stroke are things like high blood pressure, high cholesterol, high blood sugar, things like smoking, obesity. So these types of risk factors are on the rise as well. But we have excellent care for stroke patients, both in the emergency system as well as inpatient, secondary stroke prevention type things, and in the rehab side of things as well.
It's that part, that fast part,
yeah.
That some of us know, but certainly maybe not enough of us know to be able to really to save a life. Talk us through that.
So with stroke, every minute counts. Every minute we're not getting treatment is about 2 million neurons in your brain that are dying. So the fast symptoms of stroke are easy to remember. Face, and it's going to be just one side of your body. So face drooping. Arms, is there a drift in the arm? And slurred or jumbled speech, or a lack of ability to produce speech. And then the T in FAST is time to call 911. And this is really critical because our whole stroke system, our whole emergency response is really built on EMS recognizing the symptoms and then taking you to the appropriate stroke center. So not every hospital in our province is equipped to deal with stroke.
So Heather, let's go back to your story. After now, you said you woke up a couple of days later, and that obviously was some time ago now. What has that journey been like post-stroke?
Well, it started off, I was quite badly damaged by my stroke initially, physically, basically. I did have some cognitive work, and I had to learn to speak, but I'm such a talker that only took a couple of days, so that came back quickly. But it took a little bit of time to get all my brain working properly again, and now I'm very lucky. I had the cognitive part come back, and I started with just being able to walk slowly after about 4 months at Wascana, and my arm has come back, and I'm doing better all the time. My kind of stroke tends to take longer to recover, but what I really want people to know is that you can continue to recover for years, and I've already been 2.5 years into it, and I'm now working on driving, so I'm very comfortable with that capability. So getting help is really important.
No doubt about that. And obviously, I mean, that's quite the gamut. I like that part, that it could take years to recover. There's still some work to be done in terms of closing some of those gaps in that recovery process?
Yeah, I think access to some of our rehab services, there's only a few centers in the province that can offer stroke-specific rehabilitation. So that's kind of one of our limiting factors, because lots of the exciting stuff we do up front in the acute care center is really augmented in the long-term recovery, the years of getting better. is downstream in the rehabilitation side of things. And so I think that's where, you know, the next step of stroke care, we're working on really boosting the rehabilitation side of things.
There you go. Well, thank you guys very much. Unfortunately, we're going to be asking for a little bit of forgiveness from the directors upstairs. We've run a little long, but such incredible information. I think they'll forgive us, and certainly very poignant here as we look at Stroke Month here in the month of June. And if you want more information on anything you've heard, you can log on to heartandstroke.ca.